Deficiency of adenosine deaminase 2, or DADA2, is one of the 9,000 rare diseases in the world. It was only discovered in 2014, and it causes a lot of problems for the growth and development of a patient's immune, blood, and vascular systems. Not many people have been diagnosed with DADA2. Today, we've found only 600, but studies show there could be up to 35,000. DADA2 is a rare genetic disease. Patients have DADA2 because each of their parents had at least one mutated ADA2 gene, which was then passed to the child. The result? Lower or no ADA2 enzyme in the patient's body. And while we don't know everything the ADA2 enzyme does in the body, we know that not having enough of it causes problems. Let's meet a few patients. Ben lives in the United States. He's just 10 years old, but has had 3 strokes. Without the ADA2 enzyme, autoinflammation makes his body think there's an infection when there isn't one. His inflammation gets so high that it leads to vasculitis and strokes. Ben also has had fevers, swollen lymph nodes, muscle aches, joint pain, and fatigue. Fortunately, a drug called a TNF inhibitor controls his symptoms and prevents stroke. But it isn't a cure. 15-year-old Sophia from Italy struggles with a suppressed immune system. Normal childhood illnesses most people can fight off put Sophia in the hospital. Because her immune cells don't mature properly, her body doesn't make enough antibodies. More than a third of DADA2 patients experience immunodeficiency and must be on lifelong antibody replacement therapy. But again, it isn't a cure. Matteo from Argentina is 4 years old and is fighting for his life because his body can't manufacture enough red and white blood cells. His bone marrow cells don't mature like they should, and this has led to bone marrow failure. Matteo will need a bone marrow transplant, and until a match can be found, he can't run and play with his friends. Although these patients have completely different symptoms, all are caused by the same thing: a lack of the ADA2 enzyme. It's easy to see why diagnosis is tricky. Diagnostic testing is limited, and the symptoms mimic so many other diseases that these patients are often misdiagnosed. The good news is that the DADA2 Foundation is dedicated to connecting researchers, doctors, biotech and pharma, and patients and families across the globe to increase diagnosis, find improved treatments, speed the time to a cure, and support one another so all can live life to the fullest. Learn more and join us at dada2.org.